Good morning. This is Dr. Das. I am a general practitioner working in one. Today, I want to discuss about the macrovascular complications associated with diabetes. Diabetes is a metabolic disorder that is associated with high blood sugar. And this high blood sugar in blood is associated with number of complications. Some of the complications occurs acutely, that means that is of recent onset. Other complications occurs over the long term. So when you have high blood sugar level associated with diabetes, you may have the increased incidence of infection of your lungs or your urinary tract, or even you may experience increased incidence of skin infections. Different type of infection may happen as a part of acute complications of diabetes. On the other hand, when your blood sugar remains raised over longer period, it may associated with abnormalities in your blood channels, and this leads to a number of complications. We divide these complications into two groups. Firstly, the microvascular complications that affect the microscopic blood vessels of different organ. For example, you may have problem on the back of your eye, which may ultimately leads to difficulties in vision, or more serious complication, we call it retinopathy. You may have involvement of your kidney that leads to increased protein leak through your kidney in urine, and this may leads to kidney failure. This involvement is termed as nephropathy. On the other hand, when your blood vessels supplying the nerves of the limbs get involved, this may lead to weakness, numbness, tingling, or even in the advanced stage, you may experience the wasting of the small muscle of your foot. We call it neuropathy. These are the examples of microvascular involvement of diabetes. But there are other group of complications that involves relatively larger blood vessels and may affect your brain, may affect your heart, and may affect the blood vessels supplying your limbs. So when these macrovascular complications affects the brain, it may present as the stroke. Perhaps you may have seen a patient of a stroke who presents with weakness, numbness, difficulties in speech, difficulty to swallow, and all sorts of problem. It may happen. When it affects the heart, you may have chest pain as you walk, we call angina, or more serious stage, more advanced stage, it may lead to myocardial infarction, usually termed as heart attack, or further advances may lead to heart failure. When it affects the peripheral blood vessels supplying the lower limb, you may experience pain in the legs while you walk. And further advances, it may lead to ulceration, gangrene, or even amputation. So these are the examples of macrovascular involvement of diabetes. So these grave complications must be prevented. But how? Researchers have shown that these complications are preventable to some extent, but there is a problem. Although high blood sugar is responsible for this sort of problem, controlling blood sugar alone is not enough to prevent them. In fact, there are a number of risk factors that is associated with high blood sugar are responsible for these macrovascular complications. They include the obesity, then hypertension, then abnormal lipid in your blood, a sedentary lifestyle, and family history. Even if you have increased protein leak through your kidney, also a risk factor for developing these macrovascular complications. So, to prevent these complications, we must control our blood sugar. In addition to that, we must have to control this risk factor. For example, you must have to take a healthy diet consisting of lot of fruits and vegetables, and don't try to take a lot of saturated fat. If you are obese, try to reduce your body weight. If you have high blood pressure or abnormal lipid, abnormal fat in your blood, you may contact your doctor and they will prescribe some medications to control your blood sugar and control your abnormal fat in blood. And all this, controlling all these risk factors ultimately will help you to prevent these grave complications. Wish you can control your diabetes, you can control your risk factors so that you can keep the macrovascular complications away. Thank you. Thank you very much.